Welcome everyone to today's webinar. I'm Morgan Hafner with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Sheila Dreyer Van Buskirk is the Vice President of Network Research and Insights for Synchrony Financial, with responsibility for all network research and voice of the customer insights. Prior to joining Synchrony Financial, she was a strategic marketer and insights professional for several companies, including Disney, United Healthcare, and Pacific Care Health Systems. Notable is her 8 years working with consumer marketing for CareCredit, GE Capital, before transitioning to her current role with Synchrony Financial. Sheila's greatest strengths are her creativity, drive, and leadership. She thrives on challenges and innovating new ways to conduct and present research and bring the voice of the customer to life for the company. Her insights help drive new business development and expand services for current partners and consumers. Jake Gerhardt is the Vice President of Sales, Healthcare Specialties at CareCredit. Jake has been with CareCredit for 9 years, beginning in the GE Capital Commercial Leadership Program and holding various positions within operations and relationship management. Jake is passionate about healthcare financing and aiding healthcare providers with solutions to help patients receive the care they want and need today. At this time, I'm pleased to turn the floor over to Jake to begin today's presentation.
Excellent. Thank you very much, Morgan. With that, I'll take the next slide, please. Perfect. So as we see here on the initial slide, the slide is stating that CareCredit has been the CareCredit credit card, a proven solution in healthcare financing for 30 plus years. It's been quite an evolution from our beginning 30 years ago, starting in the dental industry. Today, CareCredit has presence in over 40 different medical specialties. 1 in 10 adults have a CareCredit credit account in the United States, and over 11.5 million open cardholder accounts exist within CareCredit as of today. I'll take the next slide, please. CareCredit has demonstrated to be a proven payment solution for out-of-pocket healthcare costs. As you see by the numbers, some of the metrics listed, 11 million plus active cardholder accounts on the books today, more accurately about 11.5 million as stated previously. This amounts to 63,000 times the CareCredit account is used by a CareCredit account holder on average each weekday. And we've been able to approve 201,000 new accounts on average each month. Today, CareCredit has over 210,000 locations in our acceptance network. These 210,000 providers in CareCredit's network have rated CareCredit 85% very satisfied in terms of their ability to partner with CareCredit. 97% of CareCredit cardholders rate CareCredit a good, very good, or excellent value. And we've recently launched partnerships and relationships in a retail space with partners such as Walmart, Walgreens, and Rite Aid. Last but not least, CareCredit cardholders hold an available credit overall of over $35 billion. We were able to reach this threshold by the end of 2018. This amounts to $22 million in credit limits approved each day on average for CareCredit cardholders. Next slide, please. So what does it all mean to CareCredit providers and patients? As the slide states, it's a win-win for both. On the provider side, CareCredit's able to guarantee payment within 2 business days. The program is completely non-recourse for our providers. We are able to afford our providers time savings on billings and collections efforts. CareCredit will send all of the statements, make any collections phone calls, etc. Patients have the luxury of paying over time and will not be asked to delay care or treatment when utilizing their CareCredit account at time of service. And we are able to offer promotional-based financing for our patients. We also provide award-winning provider and customer service support in Phoenix, Arizona. CareCredit is seeking a change in brand recognition, moving from what was traditionally thought of as a more elective type healthcare offering to a more traditional general purpose health and wellness partner for our providers. Today's presentation will be an excellent overview of generational studies, but I would encourage those on the line to channel questions about CareCredit and the product to myself at today's question and answer session or through my contact information provided at the end of today's webinar. I'll take the next slide, please. Throughout today's presentation, my counterpart Sheila will cover patients as consumers, generational differences impacting the patient experience, and some brief what we need to know going forward. So at this time, with all that being said, I'd like to turn the floor over to Sheila.
Hi, everybody. Thanks, Jake. So today we're going to talk about, if you can go to the next slide, please, that'd be great. Today we're going to talk about patients as consumers. Increasingly, patients are approaching healthcare as consumers. And I know you've probably heard that a lot, but now we're going to dig in a little bit deeper into what that really means. So next page, please. So when we say that patients are approaching healthcare as consumers, new policy reforms, the fact that consumers now have instant access to all sorts of healthcare technology, all those things start to affect their decision-making process, especially when it comes to purchasing healthcare. And layering on top of that, the increase in high deductible health plans, and you've got this whole new healthcare purchase path. And at CareCredit and Synchrony, we spend a lot of time really understanding that customer journey. So all these things have a big impact on how patients make decisions about choosing providers, accessing healthcare, and all of those sorts of ways to pay for it as well. So next slide. Patients are approaching healthcare as consumers. Probably for the first time in history, there is so much more to play rather than just the physical health of people. So they have all sorts of tools and information at their hands, more than any before. So much like a retail environment, patients are researching, they're communicating, they're talking to each other, they're booking and paying online, and they're using all these digital resources that are really rich, but at the same time, we know some of those can be misleading. Price transparency and comparison shopping is at an all-time high. Consumers have told us that if providers don't have financial information on their web pages, they're just moving on when they're doing their research. So if they look up a provider, especially in the cosmetic industry, they're saying, oh, there's nothing on there about how to pay for these things. They're just moving on. So providers are losing patients that they don't even know that they had. And integration of technology, it's seamless online and offline. You almost always have your phone on hand. And when we talk to our cardholders, they tell us that that's how they research things. They're going to look up a treatment, and then they're going to look up providers, and they're going to look up how to pay for them. And if all of that fails, they're going to ask their family and friends. And they may do this via their smartphone. They may say, oh, I'm considering going to Dr. So-and-so. Has anyone ever been to him before? So all of those influencers are really changing the way that people access healthcare. And patients have really high expectations now. And there is so much more than just, I'm going to the doctor and I got treated right or I didn't get treated right. Information has empowered the consumer. They do a lot of comparison shopping, and not just in retail, but in this healthcare space as well. Next slide, please. So layered on top of all of that I just told you about, that environment, there are also generational differences in how consumers are accessing healthcare and making healthcare decisions. So from a practice standpoint, it's super important to know what your patient base is and be able to be flexible and move towards communicating with different generations within your practice. So next page, please. For this presentation, we're going to focus on these four, but I may interject some things. We just did a huge Gen Z study. So Gen Zs are those people who are 13 to 23 years old, and they are just starting to enter the marketplace. So they're still really important, but we're going to focus on younger millennials and older millennials. And you may say, why did we break that up? So younger millennials still may be fresh out of college and not so into the workplace. They may have their parents still paying for a lot of their expenses. And then when you find the older millennials, those are those people that are in the workplace, they have insurance for most part, and they do act a little bit differently than the younger millennials. And then we're also going to look at Gen Xers and Boomers. All of these are super important, and within the various practices, you're going to find that you probably have a mix of all of them. They all want to be communicated to very differently, so it's important to keep that in mind as you're going through, because it really does impact the patient experience. Next slide, please. So let's look at how these generations look. So the Boomers are those people who are born 1946 to 1964. They're experimental, they're innovators, they're extremely hardworking. As far as innovation goes, they were introduced to personal computers, but that was about it for then. The technology adoption rate goes up considerably when you get younger and younger. So experiences for them, they were privy to Vietnam, the moon landing, and civil and women's rights were a big deal to them. And then we have our Gen Xers, which are the parents of the millennials and the Gen Zers, so that's important to keep in mind too. And those are people who were born 1965 to 1984. There's a typo in there, sorry about that. Traits are they're independent, free agents. They saw MTV for the first time. I remember where I was when MTV came on. It was a really big deal. And the internet was just coming into play. And they saw the very first mobile phones, but if you remember way back then, those mobile phones weren't really very mobile. They saw the fall of Berlin Wall and the Gulf War and AIDS epidemic, and all those sorts of things came into play, and that really shaped how they viewed the world. And then we have our millennials. So the older millennials, we break that down into 1983 to 1988, and then younger millennials, 1989 to 1994. You'll notice there's a little bit of a crossover with these generations, and some people define them in different ways, but for our purposes today, that's how we're looking at them. So millennials, they're optimistic, they're collaborative, they're very tech savvy. They're very used to using Google, Facebook, smartphones. They are incredibly digital oriented. They saw the 9/11 attacks, and they also saw their parents sometimes go through the Great Recession, and that's especially true for Gen Zers, and it really shaped how they looked at finances and paying for things. So all those things are really important to keep in mind as we go through this presentation. Okay, next slide, please. So today's presentation is actually the culmination of two different studies. So we did the generational health study, and we looked at, these were people that were general population and ages 23 plus. We had a mix of males and females and across all over the country. So we really feel like we got a good sense for how the nation is thinking about health and how it differs by your generation. We had 1,800, a little over 1,800 participants for this study, and you can see how they broke down really evenly distributed for male, female. So we feel like it was really representative of the US population. And then I know I mentioned that we did this great big Gen Z study. It was really interesting. So we did an online immersion, which they were required to go online and we asked them some questions, and they were also able to talk to us via video chat. Really, really interesting. And we did the same thing with their parents, because Gen Zers, this generation, if you have kids who are in this generation, they are staying with their parents a lot longer. They're being dependent on them for far greater periods of time. So parents are a big influencer to this generation, even the ones that are in the 20 to 23 range. And then we went and went in their homes. So we actually went into Gen Zers' homes and saw how they lived and how they think about things. And then we took them shopping from a synchrony standpoint. That was really important. And then we asked them some questions about well-being. And it's interesting that well-being and health to them is not defined just by physical health. It has many components, and we'll get into that a little bit further on in the presentation too. So then we talked to over 4,000 people with a mix of different generations, so that we had some comparison points for that. So next slide, please. So then we wanted to ask about out-of-pocket healthcare spending. So we know that environment's changing quite a bit. The total out-of-pocket average annual health and dental spend on self, this is in, and we asked them about ranges. Millennials told us that their copays were about $133 and their monthly premiums were around $361. So those are for insurance costs. And then total out-of-pocket average annual health and dental spend, you can see this down below. I should tell you that these are self-reported numbers, so we asked them what they thought, and we know that from doing analytics, sometimes their perception is a little bit off from what their actual spend is, but it's pretty close. One of the interesting things that I found in this, when we talked in focus groups, we found that Gen Z and young millennials pay more for their pets' care than they do for themselves, which was really interesting. That's like their first foray into adulthood. They have something to take care of. So no amount of money was too much to spend on their pets, which I thought was super interesting. Next slide, please. So payment collection technology. This is really important, and I can tell you that technology isn't going anywhere. As more and more people get comfortable with paying bills online and communicating with their providers online and having their phones with them constantly, while it's not as prevalent with older generations, you can see those older generations are adopting digital payment options as well, and at a pretty big rate. So I assume when we do this study again, we're going to see the numbers change a little bit. So right now we've got 39% of Gen Zers, Gen Xers, and Boomers who would use an online payment portal. I think that's going to change considerably. And then millennials, they like to do everything online. Whereas Gen Z, while they do research a lot of things online, they're far more likely to engage with a provider's office than their millennial counterparts who just want digital communications. And then we asked them about their plan to use online payment portals in the future, even if they didn't currently. And you can see that 40% of millennials said, yeah, sure, I'll do that. And then those older people may not use it as often. So non-millennials was 18%, but again, I think those numbers are going to rise dramatically. So the takeaway here is it's super important for you to have a digital presence. And as new technologies come, I think being able to pay for things in the doctor's offices are going to become paramount to them. So next slide, please. So then we really wanted to understand, how are people currently paying for services? Debit card is still king, and I can tell you with Gen Z and young millennials, that's how they pay for things. They're a little wary of credit, but that changes as they get a little bit older and see that how the world really works. So debit cards are about 59%, and then for younger millennials, and it's even higher for Gen Z, and then older millennials, about 47% told us that that's their typical payment method for healthcare services. Cash, believe it or not, is still king too, in some, especially with those younger millennials who may not have credit yet. But you can see as you get a little bit older, cash diminishes pretty significantly. And then general purpose credit cards, Boomers and Gen Xers are extremely comfortable using that payment method. And as you get a little bit younger, and it's partially due to their age, they don't have access to some of those credit tender types, so they're using cash or debit. Okay, next slide, please. So we asked about, do you currently have a primary care provider? And you can see that the older you are, the more likely you are to have an established relationship with your provider. Younger millennials and Gen Zers are opting for alternative care. So they might go to an urgent care center before they would have a primary care physician that they would interact with, or online treatment options. We heard a lot with the younger millennials and Gen Zers that they would look up something online before they would ever even consider calling a doctor. So just something to keep in mind, that if you're able to influence what they're seeing when they're doing those searches, that's a win and could drive traffic into your practices. Okay, next slide, please. So then we asked, in the last 12 months, for treatments not covered by insurance, how important is having a way, what would happen if you didn't have a way to pay for these things? So we asked them first, did you receive treatment? And you can see that boomers were 83%, and this is within the last 12 months, 64% for Gen X, 68 for millennials, and younger millennials was 63. And then we asked, well, if, have you ever opted completely out of a treatment because it wasn't covered by insurance? And you can see those numbers down here. And the older you get, the more you know that you might have another way to pay for things. But if you're a millennial, especially a young millennial, and you're not as familiar with financing or not comfortable asking the provider about how to pay for things, you might just walk away. However, we did ask, well, did you ever receive a treatment or follow through with a protocol that a doctor recommended that wasn't covered by insurance? And the answer is yes. So how are they paying for things? Again, those debit cards, general purpose credit cards, all sorts of things. And as we move into this space where there's really high deductible health plans, you're going to see more and more people who have trouble with doing treatments that are recommended if they're not covered by their insurance, or if they know they're going to have a lot of high deductible. And that's really where CareCredit can come in and help, because that's the answer to all of those concerns for them. And as you know, or if you don't know, it's a great thing for the consumers because it's a deferred interest plan, so they don't have to pay interest for a period of time set up by their providers. Next page, please. So we know that health doesn't just mean physical health. So we asked how important each of these was to your well-being. And we only listed 3 here, but we also asked about spiritual health and financial health and those sorts of things. And it really does seem like, and more than ever before, well-being is a culmination of all of these things. So mental health, super important to people, especially the older population. Physical health, you can see how the numbers broke down there, and we understand that arena pretty well. But things like emotional health and spiritual health are really coming into play now. So these are, you can see these numbers are all pretty high. So they're looking at well-being and health as a really well-rounded thing. And with all these different technologies like Fitbits and ways to interact with your health, those numbers are really becoming more and more important, especially from a provider's viewpoint, because there's all these different inputs as to what makes a person healthy. And understanding that may help you relate to your patients in a different way. So next page, please. So then we asked about influences on decisions to make a doctor's appointment. Recommendation from a doctor, luckily, is still #1 for most, especially for boomers. Over half of them said, I would go to a provider if it was recommended from a doctor or a reliable source. Older generations highly value doctor recommendations and that relationship that they have with their doctor. In some cases, they've had the same doctor for a really long time, and they really treasure that relationship. Gen Xers are a little bit more on the fence. They're flexible either way, but millennials and Gen Zers, they use social media more than they use anything else for getting recommendations for doctor's appointments. And they also sometimes use family and friends as well. Really funny story, when we were doing our Gen Z research, one of the guys told me, I asked him, I'm like, well, what would you do if you, weren't feeling well or something and needed to make some decisions about your health? And he said, oh, I had this rash once and I took a picture of it and I put it out on Snapchat for all my friends to see and asked if anybody had anything similar and what they did about it. And I was trying to have a poker face, but I'm like, what? But truly, they have no privacy barriers, which is another interesting thing. So whereas you're in those older generations, you may have a tendency to be a little bit more protective about your health. With young millennials and Gen Zers, they have no privacy barriers at all. They live their entire lives online. So doing things like that are pretty commonplace. And then when I said, well, what if your friends didn't have any inputs for you? What would you do? And he goes, well, I guess I'd ask my mom. I was like, okay. He was 18 years old, mind you, and out of high school. And then he said, and then, if I had to, I guess I would go to a doctor. So really different mindset in those younger generations. And good thing to remember when you're thinking about how your practice makeup is. If you have a lot of young people in your practice, having some social media influence might be a good thing. And I know if you need help in that area, CareCredit also has some toolkits that are available to you for that. So next page, please. So then we asked about future usage. And as you can see, over half of the respondents expect to see a doctor. So that's good. Doctors aren't going away. It's just how they access them that's a little bit different. So we asked about visit a doctor for physical or other preventive care, and you can see how those broke down. And then visit a general practitioner to address an illness, pain, or other reason for care, and those numbers get a little bit lower. They are using urgent care centers quite a bit. Specialists, you can see those numbers. And then what's really interesting here is when we asked about future usage of healthcare, working with a personal trainer came up that came from them, not from us necessarily. We didn't lead them down that path. They're engaging with personal trainers. They're engaging with nutritionists. They're electing to have elective surgery for cosmetic reasons, a lot more prevalent than it ever has in the past too. So even with those younger millennials, they thought, oh yeah, I can see myself having Botox or doing some other cosmetic procedure way before most of the other generations in the same life stage. Okay, next slide, please. So then we asked what information sources do you use? So another interesting finding is that patients are researching more than ever before. You've heard me talk through this whole entire presentation about how important technology is. But technology has really made access to information easy, and it's being used heavily in healthcare, especially for those younger generations. So most likely, if you were researching a procedure, you'd go to Google first and you'd type it in and see what came up. Especially with younger and older millennials, talking to family members is still a big deal for them, and Gen Zers, those numbers would even be a little bit higher. I mean, you can see what was interesting here is the older millennials kind of eked out the younger millennials when we asked about family recommendations. So they're still listening to their parents pretty heavily. So those are people that are can go all the way up to 35. So they're still having that familial influence. WebMD, what came up continuously throughout and pretty heavily with the younger millennials and the older millennials. And then friend recommendations and colleagues and coworkers. You can see how that all broke down. And the takeaway here is just it's really important to have a web presence. So as you know, when you're building your websites, keywords can come up in Google searches. So it's important to stay on top of that whole digital strategy as well. Next slide, please. So then we asked, well, how would you like to hear from your doctor or a practice? And preferred methods of communications for these two things came up a lot. So making an appointment, they still would like to be communicated with via phone, but that 29% online, that is early adopters seem to, across all the generations, they appreciate being able to make an appointment online. And then in person was 8% for that. And then fill out or update patient forms. 50% said, yeah, just send it, email it to me, and I'll fill it out and get it back to you. Or 46 are still on the phone, but that 46 on the phone is heavily driven by the older populations. I expect that these numbers are going to go far more towards digital as time goes by and people get really comfortable with adopting these technologies. Okay, next page, please. And then we asked, well, how do you want to get information from your doctor? How should the practice communicate with you? And we asked them about certain things. So bills, you can see how this broke down. Email and text messages, well, email primarily for billing or direct mail itself, so you can still get a bill in the mail. Appointment reminders, And you can see the switch here. So a lot of them said, yep, go ahead and text me a message. In this world where we're really busy, it's completely appropriate to text them a few days ahead of time and say, hey, don't forget you have an appointment, or please cancel if you can't make it. Those are becoming, as those barriers come down, it's really a helpful way to communicate with your patients. Lab results, so that's something, you know, that's still a privacy issue. Phone or email, you can see 31% said that they were comfortable with getting their lab results via email, and then text message only 4%, direct mail, and then via your website. I know we heard a lot of providers have an online portal where patients can log in to get their lab results, and that seemed to be, for people who used it, a really great tool. And then just information about your practice. Phone, email, text, direct mail, they're all still viable ways, but email seems to be the one that stood out the most. And also, we didn't include social media on this particular question, but I can tell you that some patients really prefer to interact, and they follow Facebook posts of their doctors. Okay, next slide, please. So what you need to know: optimizing the patient experience for all generations. As we've talked, there isn't a one-size-fits-all for this. You really need to look at your own individual practices. Next slide, please. But generations do matter. So if you have the ability to look at your practice and see whether it slants more boomers or if it's slanting towards younger generations, they're all important. But if you're able to tailor how your patient base interacts with you, you're going to find that by talking to them in the manner in which they want to be talked to, you're going to increase favorability towards your practice, as well as treatment acceptance and interactions with your office. Next slide, please. Consumerism is here to stay. There's just no two ways about it. It's only going to become more and more prevalent as access to information grows. Every day there's almost a new channel for getting more information, especially about healthcare. And all of those technologies are starting to blend together. So you can have a Fitbit tracker that talks to your insurance company, that talks to your doctor, that talks to all these different people like never before. So anything that you can do to increase your digital presence is going to be a win-win for you. And next slide, please. So just to tailor your approach a little bit, this can be overwhelming, I know, and you don't have to change how you're doing business overnight, but have multiple ways to communicate and interact with your patients. Change can be intimidating, but staff and patients, I promise you, will embrace your changes if they feel like they're engaged and empowered in the process. Maybe just if you don't know about, like social media channels, for instance, if you send something out to your patients and just said something along the lines of, you know, what social media tools are you using? What's appropriate for us? It's okay to ask them, and so that you get the right mix of things. And also, clear communication is just really essential. Be as transparent as you can when you're interacting with your patient base. Next slide, please. So the ideal approach, as I've kind of already said, just to combine an awareness of generational factors, tailored and layered upon the fact that technology is so prevalent in today's research environment and in how people are interacting with their retail and healthcare. So you want to give as much of a personalized experience for all of your patients, and that means being a little bit flexible and really communicating with them in the way in which they're enabled. Okay, next slide, please. So that's it for this presentation. If you would like any more information on the research that we did, obviously I didn't have time to go through the entire deck with you, and there is some really interesting research that we can share with you. Just reach out to us. My contact information is up there. Or you can obviously reach out to anyone at CareCredit and we'll be able to help you. So with that, I will open it up to questions.
Thank you, Jake and Sheila, for that excellent presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. And Sheila, we have lots of audience questions coming in right now. And the first one today is, how does CareCredit help providers navigate these generational differences?
We have a variety of different tools. If you reach out to your CareCredit rep, they can help you a little bit more than I can, but I know that we have social media toolkits for them to use. There's ad toolkits. There's all sorts of webinars and different information that we have available to people to really help them understand and research like I presented today. CareCredit and Synchrony as a whole are super engaged with talking to our consumers. I always say I have the best job in the building because I really believe I do. I get to talk to our customers every single day and work for a company that listens to them and makes changes based on what they say. So you can be sure that the tools that we provide you are based on research. They're not just us sitting in a room thinking about what might be appropriate, but we really ask the consumer.
Excellent. Thank you for clarifying that. The next audience question is, you referenced the patient experience throughout the presentation. What do you think is most confusing for patients as they navigate healthcare, and how can providers help improve their experience?
I can answer that with a definitive answer. Most confusing to people is their insurance. They do not understand how it works. They do not understand what their deductibles are. They do not understand what their coverage is. So anything that you can do to help them understand their insurance coverage when they have it, and then also be able to alleviate the anxiety that comes with not knowing if they're going to be able to pay for things by offering them, if you have in-house financing or if you use CareCredit or all those sorts of things. If you can make that part of the conversation, it helps a lot. Because we've heard from them, they just don't understand their insurance coverage, and it's changing so much. Like every year it changes. So
it's really helpful to understand. Thank you. An audience member is wondering if you have any insights on how much patients want to engage directly with their doctor by generation.
Older generations are going to be far more likely to engage directly with the doctor, but younger generations want that communication channel as well, but they may consume it in different ways. So if you had a website or a newsletter or something, they may feel like they're interacting with you, and they may even tell you that they're interacting with you more, even though all they are doing is reading about your practice. Whereas older generations really like that personal touch, and they want those personal interactions.
Got it, thank you. And another audience member is wondering, do you have out-of-pocket expenses broken out by dental versus general health care?
I do, but remember it's self-reported, so I can probably send those over to you if you'd like them, if you just reach out to me directly.
Great, thank you. One audience member is also wondering, have providers seen success in serving patients across generations by offering a payment solution like CareCredit?
Yes, for many of the reasons that I just said, CareCredit is a way to bridge that gap between those high deductible health plans that have huge deductibles. It's a way to pay for that portion of it, and it's also for those things that insurance doesn't cover. We're providing them a way to receive the treatment that they want or need.
Great, thank you. And also, how do you expect generational differences to impact healthcare in the future? An audience member is wondering about that.
I think you're going to see the younger generations interacting much differently, because they're digital natives and they're so used to accessing information via technology that those calls to the practice may become less important. But it's also something that in the healthcare field, you really need to pay attention to, because the information that they may be getting online may not be right. I mean, how many people do you know that texted or input something into WebMD and then got an answer and thought they were dying? I mean, I know my mom does that completely all the time. She's like, well, I looked it up on WebMD. It's like, Mom, just call your doctor. But I think, so access to information is great, but making sure that they get the right information is even more important. and it's going to become more and more important as younger generations come into the healthcare space.
Excellent. Access to the right information. Thank you for clarifying that. And that brings us to the end of our presentation today. And I want to just open the floor up to Sheila and Jake. And do either of you have any final thoughts before we wrap up?
I guess I would just say it's a really exciting time to be in healthcare, even though it's changing and even though it may be a little bit intimidating. It's a great time to be in healthcare. I think it's changing in a good way, and I think we're going to see a healthier and hopefully happier generations coming up as they get more and more access to paying attention to taking care of themselves.
I would echo the same. This is Jake. Yeah, I would echo the same as what Sheila said, definitely in agreement with everything she stated there. You know, this was a very beneficial discussion for myself. I've sat through it a couple times. I would certainly welcome any follow-up from those in the audience. If you have any questions about CareCredit, or you want to talk about the benefits to providers or patients alike for those that enter our network, please don't hesitate to reach out to the contact email that you see on the screen here. I'd be happy to help any way that I can.
Great. Well, I just want to thank you again, Sheila and Jake, for sharing your insights today and our audience for participating. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.